There's a good chance that the first time you meet with your mesothelioma oncologist, you're going to be feeling very overwhelmed. You may forget to ask important questions, or for that matter, you might not yet have figured out exactly what questions are important to ask in the first place. The thing is, having a prepared list of questions helps you get the information you need to make informed decisions about your treatment now and in the future. Today, I want to give you a few essential questions to ask your mesothelioma oncologist at every stage of your care, from the time you're initially diagnosed through all your treatment planning and follow-up. I'm Terri Oppenheimer. I've been writing about mesothelioma and asbestos for the website mesothelioma.net for over a decade. I'm not a physician, and this is not medical advice. But asking the right questions, it helps you become an informed participant in your own care. So let's start with questions to ask at your very first oncology appointment after diagnosis. It's a good idea to start by asking whether the doctor can explain your pathology report in terms you can understand. Ask what cell type you have, epithelioid, sarcomatoid, or biphasic, and what that means for your prognosis and treatment options. Ask whether your pathology report has been reviewed by a mesothelioma specialist or whether you should get a second opinion on the pathology. That last question, it's important because mesothelioma pathology is complex and misdiagnosis happens. Having slides reviewed by an expert mesothelioma pathologist will ensure that you're getting treated for the right disease. Next, ask what stage your mesothelioma is and how the stage was determined. Was it clinical staging based on imaging or pathologic staging from surgery? What does your stage mean for your treatment options and your likely outcomes? Third, ask what your prognosis is, what the survival statistics are for someone with your specific cell type, stage, and overall health, and what the range of outcomes are, best case and worst case. Also, find out what factors most influence your personal prognosis. Ask your oncologist to be specific rather than vague. Prognosis varies widely. It doesn't help you plan. You need realistic numbers, even if they're sobering. Now, before I go on, I'm going to take a break here to ask you a quick favor. If you find these videos helpful, please hit the like and subscribe buttons below. It makes it easier for other people who need this information to find us. Also, if you have questions or there's a topic you'd like to see addressed in a future video, send me a note in the comment section. And make sure you watch until the end, because I'm going to give you valuable information on where to find resources that will make a real difference for you. Now, when it comes to planning treatment, here are some questions. What treatment do you recommend and why? What are the goals of this treatment? Is it cure, life extension, or symptom management? What are my other treatment options and why do you favor one over others? What are the expected benefits of this treatment based on both research and your experience? What are the potential side effects and risks? How will we know if the treatment is working? If your oncologist recommends chemotherapy, ask which specific chemotherapy drugs he's suggesting and why. Ask how often you're going to need treatment and for how long, and what side effects should you expect and how can they be managed. Ask whether you'll lose hair or how your blood counts are going to be monitored and what symptoms require immediate medical attention. If immunotherapy is recommended, again, ask which immunotherapy drugs. Will it be combined with chemotherapy? What immune-related side effects should I watch for? What symptoms require emergency care? And how often will I be monitored during treatment? Ask about surgery. Ask, am I a surgical candidate? And if not, why not? If yes, which surgery are they recommending and why? What are the risks and benefits? And how many of those surgeries does the surgeon perform per year? What are the survival outcomes at this particular center for patients like you who have this surgery? And what would your recovery look like? What are the alternatives to surgery? For any recommended treatment, ask, what happens if I don't have this treatment? What would you recommend if I were your family member? Are there clinical trials I should consider? What are the financial costs and will insurance cover this? Don't hesitate to ask your oncologist what they do in your situation. Most doctors are happy to share their perspective as long as you understand that they're not making the decision for you. You should also ask about ongoing care that's needed during your treatment, like how often will I have appointments and what happens at those appointments? What tests are going to be done to monitor my response to treatment? Who do I call if I have questions or problems between appointments? That one's more important than most people realize. Also, what constitutes an emergency versus something that can wait? Is there 24/7 coverage if I need help after hours? Make sure that you have clear communication channels so you know how to reach your medical team when you need to, including knowing whether the office has a patient portal. Confirm, if they have it, that you know how to log on and use it. You may want to ask questions about coordination of care, like, will I need to see other specialists? And how will my care be coordinated between the different doctors? If you're traveling to this center from out of town, you want to find out whether some of your care can be done closer to home and whether the doctor will communicate with your local oncologist. A lot of patients receive major treatments at specialized centers, but the routine care they get closer to home. And understanding how that's going to work will prevent confusion later. Questions about side effects and quality of life are crucial. So ask what can be done to manage and minimize any adverse side effects you may have. Are there medications or strategies that help? Will you be able to work during treatment? Will you be able to take care of yourself or will you need help? What activities should you avoid and can you travel during treatment? What about exercise, diet, and other lifestyle factors? Understanding how treatment will affect your daily life helps you plan and make decisions that align with your priorities. Ask questions about the future. How often will I be monitored after initial treatment? What are the chances of recurrence and what would treatment look like if the disease does recur or if it progresses? Are there second or third line treatment options? Should I be thinking about palliative care or hospice? And if the answer is yes, when? It's okay to ask about worst case scenarios. Knowing what might happen doesn't make it more likely to happen, and being prepared is better than being blindsided. Questions you should ask at follow-up appointments include, how am I responding to the treatment based on my scans and other tests? Should we continue the current treatment or make a change? If so, are there new side effects we need to address? Has anything changed in my prognosis? Are there new treatments or clinical trials I should know about? Treatment plans aren't static. Regular reassessment ensures you're getting the best possible care as your situation evolves, and your situation will evolve. Questions about support services are very important for both you and your family members. Ask what support services are available through the center. Could be social workers, nutritionists, counselors, support groups. Ask if there are financial assistance programs and whether you can be connected with other patients who've been through similar treatment. You also want to know what resources exist for your family and caregivers. Cancer centers often have extensive support services that patients don't know to ask about. Here are a few key practical tips for your medical appointments. Write your questions down before the appointment. Bring a family member or friend who can take notes and help you remember what was discussed. Consider recording the appointment on your phone, but make sure you ask permission first. Not everybody is happy with you doing that. Don't be embarrassed to ask the doctor to repeat or clarify something you didn't understand. And if you think of questions after the appointment, call or send a message through the patient portal. Now, what if your oncologist doesn't answer your questions thoroughly or seems annoyed by your questions? Honestly, a good oncologist will welcome questions and take time to ensure you understand the answers. If your oncologist is dismissive or rushes you through your appointments without addressing your concerns, they might not be the right doctor for you. You deserve an oncologist who treats you as a partner in your own care. Actually, that brings me to questions you can ask about getting a second opinion. These include, should I get a second opinion on my diagnosis and treatment plan? Can you recommend other mesothelioma specialists I could consult? Will you share my records with another doctor if I go for a second opinion? And how do I go about getting a second opinion? Reputable oncologists support patients getting second opinions, and they'll facilitate this process. So, to review, essential questions for your mesothelioma oncologist include, can you explain my pathology and stage? What's my prognosis? What treatment do you recommend and why? What are my alternatives? What are the expected benefits, risks, and side effects? How will we monitor my response? What support services are available? Am I a candidate for clinical trials or surgery? How will my care be coordinated? What happens if treatments don't work? Make sure you write your questions down before your appointments or bring someone to take notes. And don't hesitate to ask for clarification. For more help, visit mesothelioma.net, where you'll find comprehensive information about mesothelioma treatment. Or you can call 1-800-692-8608 or use the live chat feature on the website to work with one of our helpful patient advocates right away. As for me, remember to post your questions below, and I'll see you next time.